going to be helping the doctor with your exam today. What brings you in?
Work good.
Okay. Your new job?
Yep.
Is anything bothering you today? Anything going on?
Nope.
Okay, everything okay. All right. So I'm going to start asking you some questions about your physical history, your medical history, and some questions about your family history.
Okay.
Do you have any medical problems that you're aware of?
No.
None? You ever have any problems with headaches, seizures,
Nope.
strep throat,
No.
heart disease, diabetes?
No.
None of those things? Okay. How about surgeries? Have you had any surgery?
Knee surgery.
Which knee?
Right knee.
What do you have done?
Had a ACL there.
You had that repaired?
Correct.
All right, and that's it?
That's it.
Okay. Now, let's talk about your family history real quick. And you're talking about your parents, your grandparents, your children, your grandchildren. Do any of them have any trouble with diabetes,
No.
glaucoma, any cancer?
No.
Okay. How about heart problems, heart attack, angina, stroke, high blood pressure, high cholesterol,
Nope.
history of alcoholism, drug abuse, depression or mental illness, suicide? Any other problems that you're aware of in your family?
No.
Okay. All right. Do you smoke?
No.
Okay. How about alcohol? Occasionally or?
Occasionally.
Okay. How would you define occasionally?
1 or 2 beers a week.
Okay. And your marital status?
Married.
All right. Have you been experiencing any trouble with fevers, chills,
No.
any weakness, anything like that? Okay. Sore throat? Runny nose? Any trouble with your ears or your hearing? Your vision?
None.
No blurring, no double vision, nothing like that? How about your heart? Any trouble with your heart?
Nope.
Any chest pain?
None.
Feeling it during a regular heartbeat, anything like that? How about a cough, shortness of breath? Wheezing? Spitting up a little bit of blood? No? Okay. How about heartburn?
None.
Okay. Nausea, vomiting,
Nope.
diarrhea?
Nope.
Any trouble with your bowels?
Nope.
Any pain in your belly?
Nope.
Okay. Do you have any trouble when you go to the bathroom, when you urinate?
Nope.
Burning, frequency, trouble starting or stopping?
Nope.
Notice any blood in your urine?
Nope.
Headache, seizures, dizziness?
Nope.
Okay. Joint or muscle pain?
None.
So that knee surgery is okay for you now? No pain with that?
Yep.
Do you use any braces or aids when you walk?
I use a knee brace when I run.
Okay. Do you exercise a lot?
2 or 3 times a week.
Okay. Have you noticed any problems with your skin? Any rashes or lesions? How about abnormal moles or discoloration anywhere? No? How about medications? Do you take anything?
Nope.
Even multivitamins, anything like that?
I take a daily multivitamin.
Okay. Have you had a flu shot?
Nope.
How about pneumonia or hepatitis vaccine? Are you allergic to any medications?
Nope.
Okay. How about food or anything else, insects? Anything like that? Okay. At this time, I would do a full physical assessment. However, for grading and time, we're going to proceed to an abdominal assessment. So we'll begin the abdominal assessment with the patient in a supine position with his feet placed flat and his knees bent so that I can examine his abdomen. We'll start with inspection. I'll inspect the abdomen for scarring, striae, rashes or lesions, and hair distribution. I'll inspect for the vascular pattern, for any abnormality. I will assess his umbilicus for contour and signs of hernia. I will then examine the abdomen for the contour of the abdomen and symmetry. And then I will observe for peristalsis and pulsation. I'm going to first listen in the right lower quadrant for his bowel sounds. I hear one sound every 3 to 5 seconds. I'm going to listen to his aorta. Listening for any bruits. Listen over the iliac vessels. The midclavicular line, which is approximately right here. I will begin in the midclavicular line at the umbilicus level and percuss his abdomen upward until I find the base of his liver, which is about right here. Then I will come from the midclavicular line up to find the top of his liver, starting at the nipple line. Which is approximately right here. So I will take and measure the distance from one to the other, and that is approximately 9 centimeters. Okay. I will now percuss Mr. Bilberry's liver, starting mid-sternum line, and start approximately nipple level again, and umbilicus level, and find the top and the bottom of his liver. Start at the umbilicus. This is the bottom of his liver. Starting here, I will find the top of the liver. Approximately right there. And I will measure. And find this area to be 3.5 centimeters. Okay. I will now attempt to percuss Mr. Bilberry's spleen. In this area, I will percuss at the anterior axillary line. I will percuss. Find that area to be tympanic. Mr. Bilberry, will you please take a deep breath for me? This area remains tympanic, therefore the spleen does not appear to be enlarged. Now I will percuss the rest of Mr. Bilberry's abdomen. Percuss over each of the 4 quadrants for its tympany or dullness. I'm hearing tympany, which is what I should hear. Okay. Now I'm going to proceed to palpate lightly all 4 quadrants. And I'm assessing for masses or any abnormal findings to guide Mr. Bilberry's abdominal quadrant, and then I'll proceed to assessing his liver. Let me go, and I'm assessing for any abnormal feeling, masses, anything else. Let me know if this is okay. Now I'm going to try to identify your liver. I'm going to put my hand under your ribs here and elevate right here. And I'm going to ask you to now I'm going to lift my hand over here, and I will identify your spleen. And we'll lift. And at the same area here, just a couple more, and I'm going to ask you to take a deep breath. I'm now going to attempt to practice the Bilberry feet. I will lift. Feel the lift here at the back, and attempt to softly sit right. I will now palpate Mr. Bilberry's left knee. Again, place my hand underneath his back, just below his wrist, and lift upward in an attempt to calculate the left knee. I will now listen over Mr. Bilberry's CVA to assess for friction rubs, and then I will palpate for tenderness. Take a deep breath for me. I do not hear anything abnormal. Now I'm going to feel your back right in this area, and I need you